we transition into the cooler months, it's important to remember that there's still a risk of exposure to vector-borne diseases, including Lyme disease and West Nile virus. Throughout the late spring, summer, and into the fall season, the health department actively works to prevent and reduce the spread of vector-borne diseases in humans through surveillance, public awareness messaging, and the investigation of human cases. Ticks are still active in the fall and look for a host to feed on until the temperature drops and remains below 4 degrees Celsius. Even with cooler weather, it's important to remain cautious, as reports of exposures to black-legged ticks have increased significantly in Durham Region, and these tick populations are widespread throughout most of southern Ontario. These ticks are the species that can spread tick-borne infections to humans, including Lyme disease, anaplasmosis, babesiosis, and Powassan virus disease. Detecting and promptly removing ticks from the skin is crucial. If you find a tick, remove it immediately, then clean and disinfect the bite area to help prevent infection. It's important to contact your healthcare provider if the tick was likely attached for at least 24 hours, or if you develop any symptoms after being bitten. Additionally, you can consult your local pharmacist to see if they prescribe prophylactic antibiotics for Lyme disease and if you are eligible to receive them. Although the weather might be cooler, mosquitoes may still be active, and there is still a risk of contracting West Nile virus in the fall months. The health department begins monitoring for West Nile virus every spring, implementing a region-wide mosquito surveillance and larviciding program to help prevent the spread of the virus. West Nile virus is spread to humans through the bite of an infected mosquito. About 70 to 80% of people infected with West Nile virus do not develop any symptoms. For those who do, symptoms will usually appear within 2 to 15 days after infection. For more information about vector-borne diseases, including Lyme disease and West Nile virus, visit durham.ca/ticks and durham.ca/West Nile.